Hello, I'm Gavin Morrison, and I'm a physical therapist here in Boise. And I see a lot of patients who come into my clinic with back pain. Now, there's three things that I focus on when I treat back pain. The first is minimizing pain and stiffness in the spine. The second is restoring natural movement patterns so that you can get around without aggravating the back. And the third is increasing core strength and posture. Now, the first part of the treatment usually consists of heat, deep tissue massage, gentle strengthening, and some electrical muscle stimulation to ease the spasms and get rid of the pain. Now, once patients have the pain reduced, the muscle function returns and they can get around and move easily. Then we focus on the therapeutic exercises which increase the core strength and the postural stabilizing muscles so that the pain doesn't ever come back. And this is how physical therapy differs from chiropractic care and massage therapy, in that it focuses on correcting the problems that cause the back pain in the first place. Now, one of the things that I'll use to assess and test core strength is what's called a stabilizer cuff. And it's one of the tools that we use in physical therapy to measure and strengthen core muscles. And what it is it's like a blood pressure cuff. It has an air bladder and a gauge to show how much pressure is in the air bladder. And it's used to assess primarily what's called transversus abdominis function. And the transversus abdominis is one of the most important core muscles to keeping the back safe and pain-free. Now, the way it's used to do that is the patient lies on their stomach on top of the blood pressure cuff, or on top of the cuff, on top of the air bladder, which is part of the cuff, and the pressure inside the air bladder measures how strong this muscle, the transversus abdominis, is and how well it's used to stabilize the back. Now, once we've figured that out, then we develop the exercises that are used to strengthen the endurance and the use of the transversus abdominis. The second thing the blood pressure cuff, or the stabilizer cuff, is used for is assessing and treating lower abdominal function. And lower abdominals are another primary core muscle that needs to be addressed when dealing with back pain, because the lower abdominals control the pelvis when you walk and sit and move around. So the stabilizer cuff is very good at strengthening and assessing the function of the lower abdominals. And then after that, we go after postural muscles and develop a routine, a core strengthening routine that consists of things like using exercise balls, floor exercises, some cable machines at higher levels, and I develop an entire routine that you can use at home or in the gym to maintain core strength, build and maintain core strength once your treatment is done. Now, once all that's done, and we look at posture and how tight muscles are involved in back pain. And we make sure that hip muscles are not too tight and the back muscles are not too tight. And if they are, then we develop a stretching routine to go along with the strengthening routine. So these two routines are used after the treatment to make sure the back pain doesn't come back. So that's the primary use of, or the primary way that physical therapy addresses back pain in patients. And if you happen to have back pain, you can always give me a call, make an appointment at my clinic. The address is, or the link is below, and the number and address are right here. So don't hesitate to give me a call if you have a problem or think you want to get an assessment or learn some core strengthening and get rid of your back pain. Thank you very much.